Great. You can see from the slide, and you knew from the program, that we're going to be talking about the exciting topic of taking startups global. And in fact, when you think about it, given that you want the best healthcare for everybody everywhere, and if anybody's creating a startup, then it's because they believe they have something to add to health and medicine, then wouldn't it almost be a humanitarian mission to make sure that you could take it global? And yet that's not mostly what happens. So before we get into, each person is going to give their story, and then we're going to have questions. We want to make this very interactive. We wanted to have an idea of who is here. Since the topic included the word, how do you get funding? So who here is a financier providing funding? Raise your hands. Let's. And maybe you as well? Yes? Okay. And who's looking for funding? Okay. Who are healthcare professionals? You can raise your hand multiple times as exercise. So who would be representing patient advocacy? Who's in business that's not a startup? Okay, business that is a startup. All right. Who has ever lived, really lived for at least a year on another continent from the one they were born in? Wow, that's a lot. Okay, and who speaks more than one language? Woo! So this is a very exciting group.
Is American another language?
Yes.
Okay.
Yes, he only speaks the Queen's English. But
English and there's American.
Right, right. But we managed to understand each other with. So I'm going to tell you why I'm here. I actually am an American in Paris, and I've always thought internationally and always been interested in the cultural differences, and regretted that great ideas don't just go around the world immediately. And Larry Chu, who's from the US and whom I met in Europe, and we've been together regarding different continents, asked me to do this panel, which I think is going to be very exciting. So now I'm going to ask Frank Antwerpes to tell us his story, which is how did he go from being a healthcare professional to first an entrepreneur with a global outlook, and now in the field of venture capital with a global outlook.
Yeah, well, I was studying medicine and dentistry, so I'm a medical doctor and dentist.
In what country did you study?
In Germany. Did both, but actually it turned out to be boring, especially dentistry. So that's why I walked into the industry and founded a company back in 1996, very early, in the early days of the internet. And right now I'm running a company which is serving more than 1 million healthcare professionals through Europe.
And the name of the company?
Is StockCheck. So we are kind of Facebook for doctors. On our network, doctors can inform themselves, can subscribe to different information channels, and keeping up to date. That's basically what I do. And in the course of this business, I've been looking to a lot of interesting business ideas in the healthcare field. So that's why after we went public in 2000, we were like establishing a little venture capital arm where we are supporting European startups in the healthcare scene to grow their businesses.
I want to ask you, how did you, when you initially started StockCheck, Germany is a big country. Was it initially primarily German? How was the phasing into other European and elsewhere worked out?
Well, Germany is a small market compared with the US market, so it's like you have to explore other European countries very quickly. Otherwise, you don't have the opportunity to grow. Every European country for itself is too small to grow a substantial business, even Germany. And so you have to spread your wings and check out what's going on in the neighbor countries, actually.
So was that right away you started doing that?
2 years after we've been starting, we have been exploring other countries as well, yes.
And how did that go? Was it because Europe is complicated with different languages and different medical schools of thought? What were the issues, or was it just smooth sailing?
It's a cumbersome process, as you might say, because like there's different, of course, different cultures, different healthcare systems. So it's actually more a kind of fractal you're serving. So you have to address every country on its own. So that makes it not very easy, but of course, fortunately, there are similarities, so you can figure it out after a couple of times.
And at the time, how did you finance the expansion, or was it self-financing quickly?
It was self-financing quickly, but it's very good when you have one home market in which you grow strongly and you have some revenues which enable you to go to other countries, actually.
Right. And tell us a little bit more about guano. I know that you're involved in some investment projects in various countries in Europe.
Yes, we are involved in investment in Spain and Germany and Netherlands. Normally we do seed financing, which is like not comparable to American seed financing. So we do talk here about seed financing. Most likely you're like thinking of like 250, 500, 1 million upwards. So normally ticket sizes in Europe are a little bit smaller. So we finance between 100 and 200,000 in the very early seed financing phase. And to business ideas, mostly these kind of companies, they don't have revenue yet. So it's a pure idea we are financing, actually.
And how do you select them?
Well, it's like a sieving process. You have to take a look at a lot of different companies. We have been browsing like around 70 healthcare e-health companies, and at the end it was like more 10% which were interesting to invest.
Mm-hmm. Okay, so I'm going to go on now chronologically. You have the greatest length of story in this. I'm going to go to Michael, who has, I think that many of you might have heard, would you raise your hand if you heard Michael present yesterday? Okay, so most people, Michael is an e-patient with an amazing entrepreneurial story. What I'd like you to concentrate on is how you financed the initial part in the UK, and then how it came to you that you would want to take this to other countries, and especially the United States, and how you did that.
So when I started with the technology solution, it was just solving a personal problem. It was never a business. It never started. 11 Health was never a business. It was a problem I was facing that I then went to the patient community and said, do you experience the same problems as I do, and how do you cope with it? And the overwhelming answer was just simply get used to it. So the motivation for 11 Health was not money, it was solving a problem. At the beginning, I was on benefits and self-funding and relying on friends and family to give me some seed money to allow it to grow. And the truth is there was no formal strategy to become global, because I never saw anything other than one market. And I never saw anything other than a patient in the UK being the same as a patient in America, as India, as China, or wherever it may be. So actually, there was no strategy that I had to be in the UK, and the UK was my market, and then I was going to go from there. Once I'd built or hacked the sensor and we had a device, the starting point was really, okay, what are the barriers to entry for me to be able to deliver it? One of them was regulatory, and the second thing was then who was going to pay for it. And at the beginning, if I'm honest with you, it didn't dawn on me that the end user wouldn't pay for it. I just assumed if I found a solution for myself, I would buy it. But actually, that isn't right. And not everybody's in the fortunate position like me to be able to buy it. And not everybody has access to everything. So who was going to pay for it? And in the UK, it's the NHS as a single payer. And in the US, obviously, you go through insurance. And so I went and got FDA approval for my device before we even started raising money. I Googled the FDA and phoned them and said, I need to get something called a 510K, and I don't know what it means. Will you help me? And they went, yes. And 9 months later, we went through FDA approvals. And at that point, you realize you have a product that has to scale. And the honest truth, how it started and how I raised money, I Googled again, who's the #1 venture capitalist in Silicon Valley? And it happened to come up with the name of a guy, Michael Moritz, at Sequoia Capital. And I emailed him and I said, this is my story and I have to try and raise some money. Can I have some advice? And he emailed me back saying, yeah, come meet me. And he became a friend. And I went to 43 companies to try and get funding. And the single biggest thing they said to me was, you're a patient and your survival rates are 50-50. Why would we fund a guy that's probably going to die before you can commercialize it? That was the overwhelming feeling back. And Michael said something that very different. He goes, why wouldn't somebody fund fundamentally a person that truly understands what it's like to be the end user? You don't start with technology, you start with solving the problem, and then you build the technology to solve the problem. And after about 8 months, he went, you know what, we're going to do it.
So I don't understand, you met him first.
Met him first, he mentored me, he said, you'll get funding, don't worry, it's a great idea.
But why didn't he offer initially?
Because I didn't ask him. I never asked him. I never went to him for money. I never asked him for money, I just asked him for advice on how to do it. And he was true to his word. He said, I'll give you advice, I'm not giving you money, I'll give you advice. And he said, well, you've got FDA clearance, you've worked with Medicare, you've got a reimbursement model, you've got a massive market to go for, you're a patient, you understand the user experience, you should fit the criteria to get funded. And what he didn't twig was the patient element. Sometimes the end user is the weakness in a way. And I was.
Right. But Frank, if you were exposed to an interesting story and the person doesn't say, would you invest in me? Would that stop you? Wouldn't you say, this looks good for my company to invest in? I'm really amazed at this. It sounds to me like at first he didn't want to.
No, I never asked him. And I look. If you look at Sequoia, and it's a personal investment, it's not Sequoia investment. Sequoia would not invest in a company like that. It doesn't fit them strategically. I never. Okay. You do your research on who you're going to. The 43 companies I went to all fitted the criteria of med device in my space, software analytics, that delivering real-time intervention. You have to do your research. You don't just then go to everybody.
So you really did only go to him
I went for him genuinely for advice.
Okay.
What he did use Sequoia for was do the due diligence on what I was saying was true.
So conflict of interest, and this is being recorded because he used resources on something that his company's not going to invest in. But is he the majority owner? Yeah.
Do you know what?
Yeah, okay. Off the record, being recorded. So what do you think, Frank, about what I said? If somebody came to you for advice and didn't ask you to invest and you thought it was good, what would you do?
Advice is for free. It's it's not a bad thing. So if I like the model, it's my personal opinion that you should give your opinion away for free.
You should or shouldn't? You should.
It's a good thing. You know, it's like a lot of people come, they don't necessarily need money. If you have a good business idea and it's like lifting without like an initial capital, well, it's sometimes you say, okay, go ahead. It's a good idea. It's we'll go for it. It's not like you need to squeeze in as an investor anytime if there's an opportunity. Sometimes ideas fly alone. It's like that's a hassle as an entrepreneur to get like foreign capital in sometimes. And to report to your shareholders or investors, that can be cumbersome sometimes. So if you can do it on your own, go ahead. Why not?
So Ronan Le Quéré, who is the managing director of a company that is in the process of taking a product that has been conceived in France and taking it international. But as I understand it, this product, this multimedia product, was from the beginning thought of as something that had to be worldwide. Am I correct? Would you tell us about that?
Yeah. So basically, we build a platform, digital platform, which goes to improve medical education for healthcare professionals, and the aim is to share 3D virtual medical cases on this platform. And all these cases are built by healthcare professionals for healthcare professionals. So we provide the technology, and healthcare professionals provide the content, the medical content. This is really important for us because we need to get a scientific approval of all these cases. And we built it in France, but we want to go global because we think that medical knowledge needs to be global, because in country, you have some knowledge, medical knowledge, that in other country you do not have the same one. And we think that practices, medical practices, need to spread out of the borders. So that's why we want to go global. That's why we are here in Stanford, because we want to make partnerships with physicians and even with venture capital, if it's possible. And we have talks with UC Irvine, because they are really interested in our solution. and we think that we can improve the care for patients with this solution, improving healthcare professionals' knowledge and skills.
Yes, I think that is, it's fascinating and really great, because it is terrible, this whole variation of medical practices for a patient to know that if they lived in place A, they would have surgery in this percent and otherwise they wouldn't. So it's really humanitarian to do this. But another interesting thing, since the topic includes about financing, is that from what I know, the original French investors want your company to be global, and therefore it will pull you further from their control in a way if a portion of the company becomes big at a great distance from France. You already have offices in Canada. So how does that impact the control relationship with your financiers, this geographic expansion?
Yeah, but they know that we want to go global, so they help us to go global. In the first time, we have been concentrated on the European market. So we want to go out of our borders, but we're going to target first the Northern Europe and Italy, and they think that we can go to the United States. But I think that they are really conscious that they can lose control if we want to go to the United States, because we will need more financial means, more financial investment to go to this market, because this is really a huge market compared to the European one.
And that will dilute them.
Yeah.
And this will dilute them. So have you had any contacts yet with non-French financiers? And if you don't have to give names, but any first contacts with looking for funds outside of France?
Not yet, but we do not lose our hope.
Maybe you should too. The two of you will talk. No. So what are your questions about this? Does anybody have a case so that they're looking for funds and they will have a question about how something would be perceived, for example? Yeah, I'm going to ask all of my colleagues to answer. I'm going to throw out my answer, which is your best chances will be where you have the least legacy development. Unfortunately, where you have the least legacy development, you have the least funding. But it's clear that I've spoken with people in, perhaps geographically of interest to you might be Latin America. And then if you develop something in Spanish, it might be of interest as well in certain areas in the United States. I'm saying that because I've had contacts with people who are claim to be developing the only electronic medical records in certain of the large countries in Latin America. But if you were to take the countries in Europe, that you're hitting the hardest the most structured area, complicated area to penetrate, which is, if I take the biggest hospital system in France, the APHP, which is the size of the veterans in number of beds and professionals and things. God, the layers of administrative organization to get something like what you're doing approved, it would just take you so long. Maybe you can comment on getting into the NHS with something like this?
Yeah, I mean, first of all, you got to remember 2 years from now we might not be in Europe, so treat UK differently. In one sense, you've got one customer in the UK, the NHS, which is perceived as a real benefit. In reality, you've got systems that two doctors sitting next to each other can't interact with. And I think what the NHS, so in the UK, they're quite good at identifying is what's the pain point, what is the problem you are really trying to solve, and then you will find that you've either got to go in nationally, so NHS England in this case, which is the main commissioner, or you go in locally to individual trusts. And what I would suggest, if you're coming to the UK, you try and get a pilot at an individual trust, which is a collection of hospitals or a leading teaching hospital, and scale it from there. They will look at success that you've done here as a marker for can you do it there. They will. If your goal is to sell kit or a solution to a hospital, that's one budget. if your goal is ultimately to build something in the system, but there's a consumer element to it, we announced 2 months ago a technology tariff. And there are going to be technologies that will be prescribed. They will start in secondary care, in a hospital setting, and move to primary care. So we are an innovative culture in Britain, but having a single payer makes it really hard to navigate.
A quick yes/no about Germany?
Markets are like apples. You have to bite in it to check if it's sour or not. So don't be shy. You know, the first thing that I heard when I started my company, that won't work. Yeah, so it won't work because the regulatory environment and blah, 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 blah. Don't listen to this. Is like not the point. Just go ahead and try it out. You know, we have a lot of systems in the European countries, but there's a lot of bad systems as well. So if you come up with a better idea, you can crack the market, of course. I know a lot of doctors which are quite unhappy with the practice management systems they have on hand, because it's like software, it looks like from the 90s. And so go for it and try. So it's most of the, like Germany, England, you can go along with English very nicely, so you can explore the market without like a real language barrier.
I guess the advantage also is that you can work with them at a distance to take the first steps, and if they won't even agree to a video conference call, then you sort of a predictor of how far you could
I disagree
go.
with that.
No?
I think there is no substitute for face-to-face interaction. Don't try and start a market by thinking I'll Skype you. I completely disagree with that, Denise.
Okay, all right.
If you're going to try it properly. Don't do it half-hearted.
Yes, well, there's great need for, there's a predisposition in China for improving their health system. They have a huge problem of overburden and making physicians more efficient. Afterwards, I can't say specifically, but yeah, why not? How about Japan? Would you say yes or no for him to try?
Don't let the legal environment come into your way. You know, when you read like the German data privacy law, you can like lay down in your bed and forget every kind of business. But at the end of the day, it's not that bad, because first of all, you're sitting in Canada. That means like the German Datenschutzbeauftragte, which sounds like a fucking Nazi word. He's not responsible for you, so you can act in our market, you know, like Zuckerberg does, and you know they can't do nothing about it. As long as you stick to the rules, the global rules, and do nothing wrong, like selling this to Russian hackers, you can of course go ahead and do your business. It's not a big deal. Now, when you're located in Germany, it's another story, because then you have a lot of people, you know, messing around with you. But when you're kind of from another country, you have like a legal environment which is not completely unfriendly to you.
Well, there's a chicken and egg thing here. I'm going to ask Ronan to talk about it, because his tool won't globalize unless that's the case, but it's also going to contribute to it. And they're obviously betting that it will happen.
Yeah, definitely. I think that the Eltek is going to go global, and the healthcare is going more and more global because of the digitalization of the solution. But as Frank told us previously, you have to forget about all. Not forget, but you do not have to take rules, regulatory and legal rules from each country into account.
Yeah.
You have to expand, spread out your model.
He's talking more about the care itself. Yeah. Do we believe that people will be practicing in the same clinical way from continent to continent,
yeah,
or do they already?
Because of the globalization of the knowledge in medical and in medicine. So we think that it's going to be, we're going to spread it.
I think it's an option. I think it's an option. It's already happening. You know, like for example, in Germany, you don't have the opportunity to make like telecommunication with a doctor. There's like a law against this. So you cannot give a patient advice over the internet. You can give an advice, but you can't take a diagnosis, for example. But of course, you can go to our friends from Britain who want to leave us, unfortunately, and you can, for example, go to Dr. Ed, and you get a recipe from Britain.
Prescription.
Prescription from your doctor. So it's like a way around the German healthcare system. That's all. Yeah, you just make you go on the website. You can email them. You can make a Skype call, whatever, and they send you a prescription after that.
Oh, there's a ton of stuff that's going from border to border.
That's already working. Yeah,
right.
so.
I mean, for fertility, for example, it's illegal. So much of helping with infertility is illegal in France. I think that you have to be a traditional couple, and there's all sorts of rules. So these people go to Spain. I know that there's a huge clinic in Spain that is dealing at a distance for Germany. So there's people get everything done. There are people having surrogate mothers in the United States from Europe.
I see that coming, absolutely, and I see Stanford coming to Europe as well. So, you know, the territorial business model for healthcare is dying, actually. So the patient is going where he gets the best healthcare. And if he gets the best healthcare anywhere else than in your home country, you go anywhere else. So I think we will have a completely new model of competition between major hospitals, which are like, for example, like very developed brands like Mayo or Stanford, which will come to Europe and offer maybe first telehealth services and then maybe even jump over the pond in order to open local businesses. Yeah.
Yeah, this was true already of physical hospitals. Mayo Clinic, Cleveland Clinic, and lots of them have open places in the Middle East or wherever they are invited. Africa, there's been a lot of building of infrastructure through American expansion. Yeah, Jeffrey? I think that both of a lot of this also is happenstance. It's people in an elevator at Stanford suddenly meet and then some deal happens. But I don't think there's enough statistics to really say this is the beginning. Healthcare acquisitions, there are fewer of them than non-healthcare acquisitions. So we'll have to see what happens with why things in Nokia. And Nokia is a particular case because they're deciding not to continue with their traditional business and they're going to become this business. There's another French company called Medtech that was purchased. We saw Google going in and out of health, Google and Sanofi now. So we don't know exactly where these acquisitions will go. I find that the Silicon Valley people go in, but they also go out. So it's hard to say. Pharmaceutical companies had a period where they were doing a lot of acquisitions, then they were separating, concentrating on their core business. They now seem to be in a period where they're dealing with one another, saying, you take this one and I'll take that one so that I want to be mono pathology, and they used to want to be multi-pathology. So the latest theories, so it's hard to say. I think you should try wherever you have the best fit with that particular acquirer. Yeah. So I'd like to hear from somebody whose opinion has shifted. Or something else that either that your opinion has shifted or that you felt that there was something really exciting that you heard here today. Who would like to? Perhaps somebody who hasn't already said something. Something that you found really interesting. He's been recognized. He's gotten awards for what he's done.
But the truth is, the honest truth was, it wasn't a business model. It wasn't a business model. It was an ignorant patient who just looked, okay, what's my barrier to entry? And it was going to be X, Y, and Z. So let's get that done before we, you know, genuinely at the beginning it was, I'm never going to get funded unless I've cleared certain barriers. It wasn't, oh, well, let's just get a product out and then go how amazing it is and, oh, crikey, now we've got 2 years to get regulatory or this or that. That was my instinct more than anything. It wasn't a business model.
Ronan?
And something surprised me during the conference previous days, because it seems that here in the United States you can raise some funds even if you do not have proved that the product will have some consumers. Whereas in France, you need to build a prototype, you need the proof of concept, you need to have some customers before being able to raise some funds. And something else surprised me. This is, you can raise $25 million. When we raised 5 million euros, which is about $5.6 million, and it was really huge in France. So we do not have the same business model. We do not have the same constraints. So this is really hard to address European market if you do not have a product, a solution with consumers.
And by the way, while he is here, I saw that some of you looked very interested about this virtual medical education. If you had money to invest, would you recommend this kind of a concept, the virtual medical education? Because there isn't that much of it around so far. What do you think of it as a concept? I'm throwing a question to you. Well, usually what they say in this case is that you have to find your clients, that the best way to get ahead, because it satisfies everything, is if your client can finance your development. But I understand that isn't always possible because you might need to finance an infrastructure before you can get the client. So what do any of you think?
Lie your way up.
That's the Donald Trump approach.
When you don't have the first client, or you don't have the first investor, you have to tell the second investor, well, I have somebody who's nearly investing or has already been investing, whatever. It's like approaching the truth incrementally, and then you work your way up.
Yeah,
for angels who are, passionate about.
Yeah. That's what I was going to say, is go down a route that's, if you can find a connection between people and what you're trying to do, that that individual connection, and I'm sure it's the same, once one person says yes, actually you go, all those that go, oh, it's a great idea, suddenly want to do it, and it becomes a snowball. But actually we deliberately, going back to the original story, we deliberately didn't go the typical VC route. We tried to connect with people and take advice from people who might understand what we were trying to do, as opposed to just forensically look at the business model from day one.
Ronan, did you?
Yes, and I think that crowdfunding is a real opportunity if you want to go to have some feedback from end users, and if you want to get some money. And this is a real opportunity, and I think in France, many companies start with crowdfunding.
Okay, well, this has been a great, we've reached our time. This has been a very interactive, thank you.